While Congress spends the week in recess, the nation's economic problems continue. Reacting to the characterization of the latest jobs report as an economic turnaround, NCPA Policy Chairman Mike Whalen told Fox Business News that adding any jobs is welcome news, but this latest report doesn't provide nearly enough.
They're assassinating jobs in a way that I don't think people understand. We gained 60,000 jobs above the 150 we need just for new population growth last month. The way I look at it, that's 100 months before we get back to 5% employment, right. And that's 8.5 years. We need to kick this job machine into gear.
A major part of the rebound, Whalen said, would be to free up small business lending.
The single biggest impediment, nobody seems to talk about it here in Washington, is that the federal government needs to stop stopping jobs. And people sit there and go, why aren't they lending to small business? Why aren't they lending to small business? Well, I'll tell you why. The OCC, the Office of the Comptroller of the Currency, the underwriters of small banks, have got every banker I know scared to death to make loans.
Meanwhile, NCPA senior fellow Pam Villarreal released a new NCPA research paper on the social cost of adverse medical events. Those are adverse events like some diseases and even death that occur after a patient has entered the hospital. She presented the paper, co-authored by NCPA President John C. Goodman, at a Washington, D.C. policy conference hosted by the prestigious healthcare journal Health Affairs. So how high is the cost? It could be as much as 45 cents worth of harm for every dollar spent on health care. One of the main reasons for the high cost, according to Villarreal, is the high probability of an adverse event occurring.
Your chance of dying in a hospital from an adverse event is about 1 in 200 to 1 in 500. Amazingly, these rates are much higher than the risk of 1 in a million considered acceptable by government agencies such as the Environmental Protection Agency, but little is being done about it.
The NCPA solution for this public policy problem is no-fault compensation, or payments negotiated ahead of time in case an adverse event occurs. Villarreal explains why it works.
It will encourage more disclosure, it will improve quality, and it will actually get the money to the patients who are truly injured.
Texas Governor Rick Perry was featured speaker at the most recent Hatton W. Sumner's Foundation Distinguished Lecture. Perry told attendees that many of our current public policy problems would be better solved by states, not by bureaucrats in Washington, D.C.
Left to their own devices, any one of our 50 states is likely to stumble upon a solution to a widespread problem that's significantly cheaper, more effective than anything Washington can cook up. But with 50 states walking in lockstep, it's a safe bet that nobody's going to get far in solving any of those problems. This isn't a turf war. It's about a way of doing things better. It's a way of proving that local people solve local problems better than people thousands of miles away. It's a way of keeping alive the ingenuity and the spirit that has made America the greatest country this world has ever seen.
Perry said the difference between state government and the federal bureaucracy is that states are about innovation. Washington, D.C. is about control. For more information about the NCPA, please contact us. You can call us or send us an email. We want to know what you think. And thanks for your support of the NCPA and the important work we're doing.